Hey, this is Dr. Allo. Congestive heart failure is a disease process where there's no more forward flow out of the heart. So the heart's job is to contract. That's called systole. And if the contraction is really weak, that's called systolic heart failure. The second phase is usually to relax. And this is 2/3 of the cardiac cycle. That squeeze is 1/3, and then that relaxation is 2/3. That 2/3 is called diastole. And when that phase is the problem, that's called diastolic heart failure. So when the squeeze is weak, normally your heart squeezes, and about 50 to 60% of the blood with each squeeze gets ejected out of your heart. That's called the ejection fraction. It goes up through the aorta and then goes to the rest of your body. So when that squeeze is weakened, that's called systolic heart failure. Some people have ejection fractions of 10, 15%, 25 to 30, or sometimes like just 40 or 45. But anything above 50 is usually considered normal. And most people with anything above 40 are probably going to be okay too. There's different causes of this, and we can get into that in a different lecture. The number one cause is usually blocked arteries. And then we have something called non-ischemic cardiomyopathy, where there's not a blocked artery, but there's other things that may have caused it. The second kind of heart failure is harder to fix. It's that relaxation phase called diastolic heart failure. Diastolic heart failure is hard to fix because there's not been a whole lot of medications to treat this. But the one thing we do know is if we slow down the heart enough where it has a little bit more time to relax, or we prevent something called tachycardia, or we prevent the heart from racing, then that seems to really help. There's also a newer drug on the horizon called Entresto. There's a recent study that now showed that Entresto is now also helpful in diastolic heart failure. We'll get into that on a different video. But that's kind of the difference between the two different kinds of heart failure. The reason it's called congestive is because fluid backs up. Fluid gets into your lungs, fluid can get into your legs and get into other body parts, and then when your heart's not pumping efficiently, there's not enough forward flow, blood backs up into your lungs, your legs, your neck veins, and kind of all over the place, and then that's why it's called congestion. So the acute treatment of this, if somebody's really bad, is we get them into the hospital, we diurese them with IV diuretics and get the fluid off, and then we optimize their medications with various other medications depending on which kind of heart failure it is. And then when they go home, we kind of put them on the same regimen, but more in like pills form that they can take when they go home. So hopefully you found that helpful.